So this is my video on how I would build capacity as far as a prevention program for the mentally ill population and substance abuse. The first thing that I would do is I would want to strengthen and build the partnerships with important people in my area. I actually have really easy access to people that can help me in the mental health field and also the substance abuse field because I already work in the mental health field. I have been for a few years. I have access to probation officers, police officers, judges, psychiatrists, therapists, and I also work very closely with caseworkers who deal with the mentally ill and the substance abuse on a daily basis. I also work very closely with our hospital and our emergency services department, and then also our crisis intervention, who see patients that come through the ER in order to assess them for psychological reasons. I would have no problem getting in contact with any of these people because I work with them and I see them on a daily basis, so that would be really easy. Also, coming with the territory that I work in, we have access to funds that I believe could help follow through with a plan and create a prevention program. I could pitch the idea and possibly get it started. I know that if I could get something up and running, my coworkers and colleagues would be very supportive and try and help in any way that they could. Our community has funds available for programs such as these specifically. I work closely with something that my town calls the Adam H Board. The Adam H Board supplies my agency with funds to help the mentally ill in my community stay out of the hospital and stay stable, and which in my opinion also, coincides with substance abuse. My position is actually grant funded because they wanted to try and bridge a gap in services at night and on the weekends. So I could see them pitching the idea to them and wanting to help as far as getting a program together for substance abuse, because right now it's strictly just the mentally ill and it doesn't focus on the substance abuse portion of it. So I believe a plan could be similarly implemented like that. I'm not a great public speaker, however, I believe that planning a presentation on exactly what my plans are and why there is a need for a prevention program such as this in my community would be very helpful. I know that my community knows this is an issue, but I think that bringing it to the table and bringing it to important people's attention would be beneficial, because I think sometimes it gets brushed under the rug. I would probably want to get the judges and the probation officers and the police officers and teachers into a room together and explain to them what my plan of action is. I also work very closely with an organization called the Recovery Center, who is strictly substance abuse. However, they see a lot of my mentally ill clients, and I know that if I were to go in there and talk to them, that they would also see a need for a prevention program such as this. As far as developing strategies to address priority populations, again, with the field that I work in, I have access to hospital documents and statistics that could easily tell me what our priority population is in my town. I work very closely with the crisis intervention team in our ER, and they keep a log of all the mentally ill patients that they see and what they came into the ER for, so whether it was an overdose or they were psychotic or whatever, but they keep records of that, and that's something that I could easily get access to. I already know that my community knows there is a huge substance abuse problem with our mentally ill population that needs to be addressed. I've sat in courtroom hearings multiple times, and I've listened to our judge talk in the mental health court about how big this problem is. Getting stakeholders on board with a prevention program in my town would not be a hard task at all. I think that really what needs to be done to develop and prepare the prevention workforce would be a thorough education program along with training on how to work with our prevention program. There are many people in my community willing to help and that recognize a problem but may not know how to help. Great things I think can be done if the mental health and substance abuse fields can come together for this common cause and educate our community on the issues of substance abuse in the mentally ill. This is not a new problem by any means, but it is a problem that is hard to understand unless you are already working in this field. So the main thing that I would do as far as trying to get the word out and trying to develop a workforce is the education. I think that explaining to people in the community why this is so important, how much money it could probably save from people being in the hospital, and just explaining to them the real problem that goes on in our community as far as the mentally ill self-medicating with substances and how big of an issue it is in our community, because it really is a major problem.